praying for us. And I know it's a couple of minutes before 7, so I think we just go around and we've done some introductions. But hi Beth, hi Carol. And I see Miss Anderson is on, so hello. You're very much in the dark. You look like you're a secret witness. But welcome. Yep, we have Dr. Jeff, and as I said, I've got Shar, Kathy, and Jerry here with me, and we're going to be demonstrating. So we'll have a hand technique that will be first, and we'll share with each other. And Kathy jumped on the table and said, "I volunteer." Kathy does a lot of body work on other people, and so this is the way Kathy should be seen. And she'll be with you.
Get her back on the internet.
Yes, get her back on the internet. So I am going to start the recording here. So I'd like to welcome everyone to our Symphony of Cells class this evening, and I've got some good helpers. We've got Dr. Jeff Essen with us this evening. He's going to go over some of the more chemistry parts of the oils and the physical application. And I have Shar Anson and Kathy Grove and Jerry Thielen with me, and we're going to be experiencing the oils and giving feedback here. And I'd love to thank you all for joining us this evening. So the Symphony of the Cells is something that Beth had asked me. She goes, okay, how do I tell people they need this? Why would they need this? And I'm like, okay, you know what? I have 21 years experience with essential oils, and I'm excited about this. So, you know, that's the first part. And I know, Dr. Jeff, you were quite excited about it as well, with, you know, once you look through everything, if you'd like to share your perspective.
Sure. I had gone through the training to do aromatouch at one point. And the thing about that is it seems long, it seems complicated. It seems like somebody, at least people perceived it, that they needed a lot of talent to do it. They need to be a massage therapist to do it. Now, we know that that's not the case, but the intimidation factor, I think, was enough. These are very quick, easy protocols that anybody can do, 10 minutes, 15 minutes, and you're in and out. And I think just as also as far as, here's my symptomology today. Here's how I feel right now. Here's how my kid is sick or my kid feels bad right now. This is the quick, immediate response, almost urgent care kind of thing that you can do. But it's also a long-term strategy when you combine and get the right things.
One other thing that I really like about it, like Julie had been doing oils for a long time, and the aromatouch is a wonderful thing, but it's got these 9 oils, and this gives us an opportunity to use a lot of our other oils. So if you've been collecting oils for a while, you get a lot of them, and a lot of the uses overlap, and so the protocols are all about about 10 oils, something like that. Yeah. But they use different ones, and if you don't have the particular ones, you've got a chart in the back of this little booklet that you can get. And I'm sure Julie's going to have that in the chat or whatever, how to get it. But you can substitute. So it gives you 3 other substitutions. So it's really a great way to use some of those oils that you said, oh, gee, I love bergamot, but what can I use bergamot for? It's not in the aromatouch technique.
Right. Well, and so the one thing, so Beth, you want to share your experience when you had the Symphony of Cells?
Oh, well, yeah, and I didn't actually have anybody doing it on me. I did it myself, and I chose I think it's the one we're doing tonight, the forgiveness? No.
Yeah. That's what we're doing.
And it ends with, no, it wasn't that one. Oh, I know, it was the Emobic. It was the one that I did. And I got to the end, and I put that spearmint on, and like my whole being was like, oh my gosh. And now anytime I apply any oils, combinations, I have to end with spearmint. It just makes me like, oh my gosh, this is so amazing.
Well, and so the first time that Shar and I exchanged, I had gotten one that ended with Siberian fir, but I'd been having a lot of discomfort, and so I decided, I said to her, I'd like to add copaiba along with Siberian fir. And it was so interesting when she put the Siberian fir on me. It was like every cell just went, yay! And I felt this really excitement feeling in my body, and my cells felt just clear. And then she put the copaiba on, and I kind of just dropped into that space, like, when you're half awake and half asleep, like you lay down just to take a quick nap, and you don't really sleep, but you're really relaxed. That's how I felt. And it was amazing. So the next week, then Shar said, when we put the last oil on, she goes, okay, now I'm like a puddle on the floor.
And it's a really nice order. Most of them he has end with peppermint, but not all, because peppermint's such a good drives in the other oils. But spearmint would do that too.
Yeah.
And,
No, it's really interesting, and a lot of it is, through the years of experience that I have doing massage, I would just look at, the person, how they felt, what I was feeling for them, and I would kind of tell a story with the oils, much like what he does. But that came from having the experience that I had. This gives you that tool without having to, observe or learn, the experience of, okay, this body is feeling this. Boyd's background is also that he was a massage therapist. So, I just find it very interesting how he puts things together. So there is a book, and if you're in close proximity to me, I ordered like a group of 40 of them. So the book is called The Symphony of Cells, and this is what it looks like. And the cover is what I had for the announcement for the class. So it's like a bunch of gears, and it says Symphony of Cells. And so the introduction is so this is when the actual Symphony of the Cells manual was created. It was only available at actual day events where each of the protocols, the purpose of each oil, and why it was used were discussed in great detail. This made it necessary that there should be blank pages for notes to each protocol. Because Boyd could only do so many teaching a year, the interest and high demand led him to sell the booklet separate from the training. So this book was then made available to the public, but it is still used at each event. So the blank pages are still nice to, okay, maybe I substituted this, or, so forth. Now, this is whether you're looking to support a loved one with an ongoing ailment or illness, or are integrating the use of pure therapeutic essential oils into your massage or wellness practices, the Symphony of Cells is a simple and an effective tool. It is meant to bring harmony physically, emotionally, and spiritually within the body. Each of the 18 protocols focus on a specific system and or area of the body, and allowing for the targeting of the symptoms and underlying causes of many ailments and illnesses. So he added new protocols after the new oils came out. So there have been 2 new ones. So if you have an older version, the version I have has 18. Now in your book there are guidelines. So the C is for carrier oil. There's one that looks like a nose. So you put the hand under the nose for the person to smell. Sometimes they may ask that you put the oil over the heart. Your liver is on your right side on your rib cage. So there are a couple of them that ask, and the one we're doing tonight is going to be applying over the liver. Applying oil to the neck and shoulder area. Applying to the feet. So we'll be applying oil to the entire back, it will show the spine, and applying oil to the hand. There's some that shows the hand. It's very simple to do. You can use a hot towel afterwards for some of them if you would like. That just adds to the relaxation and to the experience. Now, a hot, moist towel will actually, Shar talked about the peppermint being a driver. Moisture will really accelerate or drive that oil into the system as well. But it's very relaxing to do that. And so then there's also a gear key. And so there are some that have a heart for the cardiovascular and circulatory system. There's one that shows a stomach for the digestive. The emotion and limbic system are put together. And that shows a brain and then a heart and is in purple. The endocrine system is another purple. Immune system is gold. Integumentary system has the hand. Nervous system is blue. Respiratory pink. Skeletal muscular connective system is green, and then the urinary system is like a lime green. Now, tonight we are going to just talk about a basic protocol. That's the first one, and that's something that's easy for you to do yourself. And you know, if someone has gotten the Home Essentials kit, they may not have the massage blend. If that's the first kit that they have. If they don't have the massage blend, have them either substitute Breathe or Digest-N. Okay? But the massage blend is the Aroma Touch. Okay? And so from that, you can substitute, right? If you don't have, if you think, okay, I don't want to do that, just do the frankincense, melaleuca, and peppermint. That's fine. You could substitute lavender in for this. The beauty of this is substitute what you feel might help what that person is experiencing. And so the basic protocol we were going to demonstrate this evening to do yourself. And so we're going to begin with frankincense. Now I'm going to invite everybody to still use carrier first with this. So I'll pass the carrier oil around. I feel bad, we've got Jerry sitting here on the end. My camera doesn't have a good wide.
That's what Dan can say.
Okay, okay. She's camera.
I had to take that off.
We're gonna, yes.
I can hear her voice.
So to apply this to the feet. But we start with the frankincense, and the frankincense is going to go on your shoulders. So put that on your shoulders. We're going to put some on our feet too? No, we will.
We will.
Or not yet. Not yet.
Just shoulder and neck.
Shoulder and neck, and then.
Frankincense in here?
Oh, I have frankincense. I'm not sure.
Okay.
Okay.
So frankincense, shoulders, and then smell it.
It just smells so good. Okay. And rub it on your feet.
All right,
Okay.
we're putting it on our feet.
So put it on your feet. Okay. And then, that's the first oil, okay? And most of the protocols start with frankincense. And the frankincense will go on the shoulders. I did have us do the carrier oil to start because we're still kind of dry, but it doesn't call for the carrier oil and the application on the spine until a couple oils in. So you start with the frankincense on the shoulder and then have the person smell it, okay? So the next oil is Melaleuca. So Jeff, would you want to address why perhaps he's beginning with the frankincense?
Well, not only on this one, but almost all of them. Frankincense is a regulator. How I use it in my clinic is when people have things that are by communication pathway going off balance. I use frankincense, especially through the pituitary reflex point, but it also applies just about anywhere. Frankincense helps the body systems communicate properly with each other. So it's the tone.
So it's for communication.
Yeah.
So with that, the Melaleuca, the second oil goes on the spine.
And since we're doing it on ourselves,
So just rub, so how I do it is I put on the back of my neck and then my low back, okay? And then rub your feet. This one is not asking for us to smell it. So let's say you have kids. The frankincense touch, right? Melaleuca touch. And again, either diluting the aroma touch or using one of the other touch oils for a substitution for the aroma touch. But using the touch oils would be a way that you could use this on your children, okay? So the next one is the aroma touch. And I guess I should have asked how you guys were feeling before we started. I didn't, we just kind of jumped in. I'm noticing I'm feeling better.
I'm feeling more awake.
Yeah, I am too. I feel like my energy is running up and down better. I don't know, is anybody else noticing, if those of you who are going along, is anybody else noticing anything for themselves?
I don't usually notice unless I actually have to think about it. So. Unless it's really dramatic.
Well, so, Dr. Jeff, do you want to talk about the effect it has, just the smelling of the oils, how that affects the person, how you...
Well, yeah, I mean, the science of aromatherapy began there. Part of our brain, called the olfactory bulb, is literally right in our sinus cavity. It's a part of the brain that is exposed directly to the outside world. It's the only part that's like that. And so as we smell things, there's a very strong ionic charge to things that we're smelling. In other words, there's an electrical static charge on every particle. Those static charges are then attracted to receptor sites, little sort of fern-like structures in our nose that help grab onto those little particles. Those particles have an electric charge that just by itself can portray smell, but then so can the actual chemical contact. So we have two ways of smelling. We smell the electricity of whatever's in our nose. We also smell the chemical of whatever's in our nose. And this is why essential oils are so pervasive, because their electrical charge is so strong. And chemically, they're so concentrated that most things in nature would not have both the combinations of those. So because of that, then those olfactory bulbs go right into what's known as the limbic part of the brain where we feel emotions. So we can have a very strong emotional associative reaction to smell almost immediately. When I give this example, I give the bad example first. What is your emotional impact when I say skunk smell? Nobody likes that smell, and everybody smelled it and they go, yeah. But then think of the most pleasant smell. Think of, for me, I'll give you my example. My mother, every Christmas, used to make Christmas cookies with clove oil in them. And to me, clove was always set off a great big emotional, positive response. And everybody has their own individual version of that. The positive or negative responses can be literally within 1 second, half a second, 0.2 of a second, depends on who you listen to. That impact can get into our brain. Once it's in our brain, the whole body begins to have a cascade of all this stuff.
And so, like the frankincense, so for those of you who are following along, that just smelled so good. There was just this sweet almost smell to it. Now, this basic protocol, someone had asked me, so why would I use this? So you talked about the frankincense is clearing the cells, and then the Melaleuca is another cleaner, right? The Melaleuca is something that's going to, so if the frankincense works with the cell communication, the Melaleuca can go in and help support the body in clearing.
Yeah, well, they'll be able to see it on the read if they do a replay. Okay, so this is nothing.
All right.
Julie, another comment then about the Melaleuca is, and looking at this entire blend, the Melaleuca is here to engage the lymphatic system,
Okay.
where our last one, peppermint, is more about engaging the blood system. So between the two of them, they're moving a lot of fluid around.
Okay. And Aroma Touch is also going to be moving things around with cypress being the first oil in that blend. That's going to help move the circulatory and support the muscles with marjoram. The basil is going to help with reducing inflammatory response, and it will support our adrenals. So, anything else you can add to that?
Well, I would say Aroma Touch is going to have a little bit of an effect, especially for our structural tissues, muscles, bones, ligaments, joints. It's going to have a more proper immune response. And also then by lengthening muscles, especially with the marjoram, by having the spasmolytic activity there, we allow more flow. In other words, pinched off muscles don't get adequate blood flow and they don't let lymph flow through them. So if we relax those muscles, they're capable, again, this entire basic protocol to me looks like, let's get things moving.
Okay, yeah. And then peppermint's gonna really help and send that last, home run hit to go through everything.
The last directive.
The last directive, yes.
Should we change the mode so that it's speaker? Then the people on
All right, so,
the Facebook Live will see the speaker.
okay, there we go. All right, thank you. Okay. Okay, so, now it's not changing.
Oh.
Okay,
Don't you, well, if you, that may not be the speaker one.
okay, so how do I,
There should be one that allows you to do relaxing.
Can I ask a really quick question?
pardon?
Yes,
Amy?
it's switches to the speaker.
So I'm almost out of my Aroma Touch.
Yep,
She desperately needs to have this treatment done.
okay, yes.
But I have all of the individual oils that are in Aroma Touch. Could I conceivably take like a drop of each one, and would I do it all at the same time, or one at a time?
If you wanted to put a drop of each into your Aroma Touch bottle that's almost empty, then you're making,
Quasi blend.
use your bottle that you already have.
Ooh, do I need to put any carrier in it?
No,
Okay.
But
no,
he also
So-
has alternatives, Amy, and the alternatives that he gives for the massage blend are basil, cypress, or marjoram. So if you
Just one of
had
those?
yeah,
any one of
and
those.
she has all of them, so.
I have all of them, so,
Yeah, okay.
okay, cool.
Let me see.
My project for tonight.
All right.
Okay, so let's see, how do I want to get the full screen that is us, and I'm not sure why it isn't going to me then when I'm talking.
All you have to do, Julie, is just speak and it automatically switches.
But it's not switching when I speak.
I didn't come up.
Are you seeing her?
Are you seeing
I'm
me?
seeing the three of you.
Oh, okay.
Okay,
When
alright.
Amy spoke, I only saw her.
Okay, well,
Only-
what's happening on the thing for the Facebook Live is it's not flipping it over. So we'll have to show
Yeah,
the
you'll-
Facebook Live, someone will have to move this to view the table.
Okay,
Not
that'll
here.
work. That'll work. We'll
Yep.
do that one.
So, okay, so now we're going to do the second protocol, which is the forgiveness protocol for the evening. And,
What we
um,
do first?
so,
The first part, we just
well,
did?
I'm just showing the basic one, that
Okay.
was called the
Okay.
basic protocol, and it's the first protocol in the book, so it's the most simple one, okay? And, I think it's just to demonstrate you can do this without a lot of oils, okay?
And you were using like one drop of each?
Yep, I just did one drop of each. Now, it was interesting, so, I have not yet taken, Boyd hasn't been anywhere where we can take the class yet. It hasn't been close. But my good friend PJ Hanks had taken the class twice from him, and she actually did a webinar. I know some of us were able to be on that, but, one of the things that she said, so I guess I'll start here, is he really, really, really stresses enzymes. We can't take enough enzymes. And he also really stresses, yes, the oils are amazing, but our foundation is the Lifelong Vitality Pack and the enzymes. And so you know, he's talking about, and I know, Jeff, we've done some webinars where, you know, how the Lifelong Vitality Pack really helps the, you know, the body utilize the product. And so from that, if you just want to address that.
Yeah, certainly. I mean, everything that happens in our body as far as any chemical cascade requires enzymes. Every one of those enzymes requires nutrients to make that happen. A lot of conjugation through the liver, through the lymphatic system, in our digestive system. Everywhere you are required to have little bits of nutrition here or there. Magnesium, zinc, B6 are the most prevalent ones of those, but literally every little nutrient has its role to play as a cofactor in a process of chemistry. So if you put oils into a chemically deficient body as far as nutrients go, the effect of the oil may not be as profound. Those people who oils move the best are those people who have fulfilled all those nutrient things, vitamins, minerals, amino acids, and so on.
And so in order, you know, for us to have a symphony, we can't make good sound if we're out of tune, you know, and that's the best way to look at it. And you know, Amy being a musician, I know she actually does a presentation with tuning forks, and you know, how when you put tuning forks, they'll you tune one and it will resonate with the other one. And you know, that's basically how we begin to create our symphony, is having our body be in tune. Would that be a fair way to say it?
Yeah.
Okay. So in life, I'll put a copy of it out, I think.
Well, for people that are actually going to be watching the recording, it's nice to see it.
Okay, all right. So for many of us, there are things that happen in life that aren't easy to live with, right? And so the forgiveness protocol, other than the basic protocol, a really good place to start is the forgiveness protocol. And so it's something that helps us be able to move through things with ease. And so the reason I selected the forgiveness protocol is for that reason. And Boyd had said, you know, that the emobic protocol, so Beth talked about that one, the sensory protocol, and then the, I had them written down, but I don't have the right, the hormone balancing protocol, and the neurological are all ones that will work with, and the solar protocol, help support emotion. But the forgiveness protocol is where we're going to start. And so, Kathy, we're going to do a little rearranging here, because we began our class sitting so we could see what we were doing with the first half, and we're just going to quickly move the table. And Kathy, if you want to go get ready, sure, we'll get this taken care of. Just take the sheet off the table. You can go in the other room.
Oh,
And get ready.
I need to put my jacket on.
Okay, all right. You want to do that? So we'll get this moved here and get the camera moved for everybody. So if you'll bear with us for a minute. Does anyone have any questions so far?
Well, I just think to reiterate more about the digestive enzyme.
Will you be able to see the feet?
Yeah. All right, we'll move it when we can. Okay, and then somebody's going to grab the. Yeah, so Jeff, do you want to talk more about the enzymes while we're doing
The
this?
specific enzymes that are in here.
Julie, I didn't hear where to put the peppermint and the aroma touch.
On the spine and on the feet.
Okay, thank you.
Yep, just the spine and the feet. So, okay.
Most of these are the same. He'll kind of start out with the shoulders, and then most of the oils are spine and feet.
camera up here. Okay. And then, so the first part we do standing up. So we're going to put Rose on the heart. And then the next one is going to be Geranium, and Geranium will go on the liver.
That's the right side.
The right side, yep.
Very
Now-
good, Kate.
Rose and Geranium have a very similar, they have a similar profile, I guess is the best way. Now, are you okay with Rose, Jeff, or?
Well, I personally don't like the smell of either one of those oils, but I do love their effects.
Yes.
The rose I would put more as a circulatory remedy, which is why it's logical to put it on the heart. It also is very good for close personal relationships, good for the heart chakra. Whereas the geranium, even though it's very similar in chemistry, is a bit more of a cleansing kind of oil. It's going to have a little bit more propensity to move things along from the excretory organs. So it's logical that it goes on the liver.
Okay. All right. So Kathy, there we go. Yep. Over here. So the really nice part about this is you can do this. I happen to have a massage table.
Just happened to.
But yeah, I just happen to. Do you want to move the camera just a little bit over this way? 'Cause you can't quite see her back. So just turn the whole tripod. Turn the whole tripod. Don't touch the camera. Turn the tripod this way, not that way. Towards me. Perfect. Right there. Okay. So you can, because I have a table, we can do this here on the table. But you can easily do this on the end of the bed, and I actually prefer it on the end of the bed this way, not lengthwise. It just seems easier that way for some reason. But it's not uncomfortable for the person to lie on the bed. They could also be on a couch, and you could sit on the floor and do this. It's just a much easier way to do this, to me, and it takes a lot less time than the Aroma Touch, which is another thing that's easy. I like it because it's easy. So while standing, the person is to apply the rose over the heart and then geranium over the liver. So then while lying down, the first oil is the frankincense. So the frankincense, I'll put on both my hands, and then I'm going to stand at the head here and put them on the shoulder, And then the one thing I do is, like with the Aroma Touch, to do that kind of scoop in the neck so that it gets up in the neck, and then I just hold it for a second. Now, if you're in a hurry, as you noticed when you did the basic protocol, for those of you who followed along, if you're doing this yourself, you're going to get the benefit. The beautiful part about touching is, if you've got time, spend a little more time with this, because the touching is a nice experience. So the next oil is Neroli, and the Neroli is in a roller bottle, and it already has carrier oil in it. So I'm just going to do a swipe all the way along the spine with the Neroli. So I went all the way up. And how I like to do it is to take both hands and circular motions on the spine. And again, if you have time, what I like to do is I like to do that 3 times. Because it feels good.
What is the substitution for Neroli?
I'll look it up, hang on.
Thanks.
So you could do, I've done petitgrain, I've done wild orange.
Petitgrain
They
and
both
lavender.
come from the orange tree.
It shows Melissa and lavender and petitgrain.
Yep.
Okay.
Yep. That's good.
I'd also throw magnolia in there as a possibility.
And that's the nice thing I think about this protocol is that it is flexible. You can use your intuition. You don't have to do it exactly as prescribed. You can adjust it.
Okay, so now I'm doing the carrier oil, and I probably put about a quarter size in my hand, and it's more relaxing. So if you notice, I poured it in my hand. It's more relaxing to pour it in your hand and then put it on your spine than just pour it on them.
Warmer.
It's warmer, and the other thing is you're less likely to have it go all over the place. You have more control over the oil, so it won't, slide all over on the person. Now I like to make sure that then I get that carrier oil on the neck and shoulders well, because there could be a warmer oil coming up. Now, if you're doing this like we did the basic protocol, putting it on the neck and shoulders and on the feet is still going to be very beneficial, okay?
And that's how you would do it for yourself if you were just having to do it for yourself.
So now the next oil is clove, and clove is a warmer oil, okay? So putting this on, so now I'm doing 1, 2, 3 drops. You don't need to do a lot. Now this is going directly on the spine. And so I'll do one swipe all the way up to the neck, and then I'll come back down and I'll do the circling 3 times.
And that's just to spread the oil out a little bit at the beginning, right?
Mm-hmm. And so I didn't do this perfect either now because I didn't have her smell them. So I'm going to go back. Here's the frankincense. Okay. And then I'm going to have her smell the neroli.
Like a little chimney coming up.
Yeah. So if you forget, you can go back, because it does really add to the experience to be able to smell them. There's something about, they smell very, the uniqueness of each smell.
And as you layer them on your hands, that you're kind of making a blend and it just smells great by the end.
Okay. Okay, so now we're going to go to the feet. And I'm going to put some carrier oil on her feet. Jerry, if you want to move it so they can see here. I'm going to move the camera so you can see what I'm doing on the feet. So if you want to spend a little extra time, you can cap their ankles. And this just feels good. This is a good support area to do this. You can spend extra time on the heels if you have time. So when I have time to do this, this is what I like to do with each one, is to have some area of the foot that I spend a little extra time on, okay? And we had frankincense on the other time, so I'm not going to worry about putting that on this time, okay?
And just so people know, you're getting these great professional tips from a massage therapist. The actual protocol is get it on, but you can do really wonderful techniques while you're doing that. If you know what you're doing or get an idea, or Julie shows you some extra special touches.
So this one is Melissa. And you've been getting them as I'm going? Okay, so I don't know where.
Okay.
I know you got the first, so just, you can take as.
I didn't get the neroli.
That's right there.
Okay, and just put it on the back of here. It's fine. You can put it on your hand first with the roller ball. Put it on your hand first.
So is the Melissa going on the back?
The Melissa's going on the back.
So you just go to the feet for the carrier oil, that's it?
No, I'm trying to teach and talk at the same time, and it's not going very well.
Okay.
So,
I'll show you the protocol here, but you kind of see it goes spine, nose, feet, spine, nose.
and this one is alternating with some of that. Most of them are very much, it follows by the book. And, so now I've put the Melissa up. I'm going to have her smell it. And now I'm going to go back and put that on the feet.
Yep.
So I take, now this time I'm going to really rub inside the arch of the foot with the Melissa. And you don't have to be, I mean, it doesn't have to be anything special that you do when you rub their feet. Just, you know, each time you put it on, pay attention to a different area.
Substitutions for Melissa, since not everybody's gonna have that, would be black pepper, lemongrass, or copaiba.
Thank you.
Good, Carol, you should do that every time.
Okay.
Good.
Juniper Berry.
But get Melissa.
Yeah.
Yeah.
Use your points and get Melissa. You will not regret it.
Yeah. So, Beth, do you want to read what Melissa does? Do you have that handy?
Yes. And can I read it or do I have to be compliant?
Read it.
Melissa, top uses, and I am reading from the Essential Life book. Everyone needs this book. Yes. It is, the top uses are for fevers, colds, and viral infections, cold sores, herpes, and fever blisters, depression, anxiety, and shock, bites, stings, and warts, allergies, hypertension, palpitations, and high blood pressure, vertigo, eczema, infertility, sterility and menstrual issues, dysentery and indigestion, and of course, emotional balance.
So for people who are in need of emotional support, putting Melissa on your thumb and putting it on the roof of your mouth, just a drop on your thumb, and then placing it on the roof of your mouth and just be quiet with that for a bit, it's amazing. Absolutely amazing. And so now the last oil that I've applied was Juniper Berry, and I'm now going to have Kathy and all that. And Melissa is in the On Guard Plus. It's also in Elevation. It's in. Yep, it's in the Breathe Drops.
It's in, I think it's in, yeah, the soft gel. I think it's in one of the emotions.
So if you've had Aroma Touch training, I like to at some point while I'm doing this incorporate doing like that I'll come down the toes and come down each zone and then just pinch the end of the toe. Again, it feels good and it's encompassing a lot of regions. So to get a little bit of reflexology in with this isn't going to hurt anything if you have the time. Okay. All right. So then bergamot. And Carol,
0 substitutions for bergamot. Boy, the Juniper Berry and bergamot both jumped out.
So the bergamot would be grapefruit, whisper, or lime.
Okay.
And Juniper Berry is the Zendecrine, coriander, and the renewing blend, which I think is Forgive.
So I know on the Zoom, because I turned the camera so you can see more of the feet, you're not getting to see as much of the back, but I'm circling this up all the way to the top of the neck. And then I'm having Kathy smell. And then we'll go to the feet.
What was that one?
Bergamot. So I think, you know, not rushing and adding in what I'm doing makes this about a 25-minute treatment, because we did this, it took 25 minutes at Jeff's office. How did you feel afterwards, Jeff? I know you had to travel after.
It was unfortunate that I had to get going so fast because it actually felt really good and I wanted to just take a nap.
Yeah.
But yeah, it was very balancing. I did notice better integration of the spine and spinal cord. Lasted for, I would say, a couple days.
Okay.
Yeah. I would say that definitely was.
So the last oil is Forgive.
What?
Forgive.
Renewing blend is the generic name for it, but it's the Forgive blend from the aroma, the emotional aromatherapy set.
So if I substituted Forgive earlier for Juniper Berry, should I just do Forgive again or put in a substitute for that?
What does Carol say?
For Forgive is bergamot, Juniper Berry, or myrrh.
So if you have myrrh, do myrrh, Mona.
Thank you.
For the juniper?
Just do Forgive again. It's a forgiveness protocol.
Well, or, you know, if it's Juniper Berry because you don't have Forgive, then you, yeah, however, or if there's another one that you feel drawn to.
I'm kind of drawn to the myrrh.
Okay.
I haven't used it for anything yet, so I think it would be nice to include that.
Yeah.
Great idea.
So another thing that I like to do when I'm doing this, because, you know, if you think about how much tension you get at the base of your skull, I'm pinching a little, not hard, but I'm just bringing my fingertips together now and kind of, you know, bringing them to the center on her neck at the very top, like where her hair meets her neck, because her neck's got a little bit of tension in it. And that just, it's a nice, it feels good, doesn't it, Kathy? Very good. So, you know, if you like to add a little extra touch, so I'm putting my hand, I'm cupping her neck, and then I'm just slowly bringing this together at the base of her skull. I'm going to do that 3 times because I feel like that's a nice way to end. And then I'm also putting my other hand on her sacrum here, because this is the last oil. And then bringing that to her feet. And I like to end on the feet that I take and go like palm to palm. It's almost like a hand over the heart, kind of. Just to really, you're covering a lot of organs when you do this, just to kind of give a little push on either side. And again, if you don't have time to do this, that's fine. I'm just showing a few little tips. And then I like to give a little stretch. Okay. How you doing, Kathy?
Really, well,
She's not a puddle on the floor.
Oh, give her a minute.
Huddle on the table.
Puddle on the table, yeah. So, okay, okay.
What?
Forgive does call, that's true, yeah, that's a good observation, it does call for action, you know. How do you feel, Jerry, what did you notice?
it's weird, I don't,
Yeah. Okay, yeah,
We can't hear either one of the ladies.
okay, so, Jerry, you wanna come up here?
Oh, yeah. In the beginning, I just felt really teary, like a release of through my eyes or something.
Yeah.
Can't wait to try this one.
I felt like it was, all the times I've told people to, you know, that forgiveness, it starts with yourself, with your own self-acceptance and stuff. And I would say that I just kind of felt this sort of deep composure about myself, you know.
Okay. Yeah.
This one is a great one. I've had this one twice, and it's a really nice protocol.
Yeah.
But it does have oils in it that some people might not have, and there's lots of protocols. So encourage people to get
Use what you have and
use what you have.
And that's what points are for.
Yep.
that's what points are for, that's right.
Use your points.
So I have a question.
Yes.
I have a client coming in that I was going to do the aroma touch on. He's an addict.
Okay.
He's an alcoholic. He's just going into recovery. He's not really accepting this right now, but we're trying to give him something to just kind of, get the ball rolling here emotionally, maybe.
Yep.
So, just wondering what the doctor would say.
Okay. Jeff, you want to address that?
I think given the little bit of description that I have of the situation, I think this forgiveness protocol is the first thing I would do. Simply because he has to be emotionally ready, he has to be motivated. If he's not motivated, no amount of therapy or no amount of detox will help him. And so having that sort of forgiving himself aspect, forgiving the situation and circumstances that they have contributed to the addiction, even forgiving the alcohol, weird as that sounds. I think this protocol that we just did would be where I'd start. Now, as he moves through that, then help with the liver in terms of what's the one that works well there? The liver was cellular protocol would do well. I would also maybe look at the digestive protocol because that's going to also include some liver and downwind from the liver on that.
Well, and in the emotion, anger stores in the liver.
Oh boy, big time. This is one of his huge issues, the anger.
Yeah. So, this is something that can really offer support for that. And the rose or magnolia, either one of those would be really beautiful. And I know the magnolia is, for a floral oil, very reasonable price-wise. And I think, is it also in the Kids Stronger blend, the magnolia? Is that the one?
Yeah, it is.
That would even, we'll talk more, Cheryl. I did
Really good.
a talk through on Saturday with Bethany's granddaughter with the children's oils, the kids set, and really, it's support for the kid in all of us.
Yeah, right.
We all have something that happened when we were younger. Even it doesn't have to be a horrible thing, but there can be things that that happened to us when we were younger that still store and are a message that comes forward through till today. And that kid set of oils is another really great emotional support tool. But I think, you know, we can talk more about that, but this forgiveness protocol is really a great place to start. And I would say use the oils you have, and if you need different ones, I know, because we'll make sure you have them all. Okay.
But listen to some. At the beginning of every protocol, it's got possible associated issues. This one, I'm not going to read them all, but the ones that might be relevant: anger, resentment, cirrhosis, abuse, depression, hate, mental fatigue, fear, emotional trauma, post-traumatic stress disorder, OCD, jaundice, rage, liver disease, hypertension, broken heart syndrome,
Wow.
loneliness. So yeah, this sounds like a good one.
Yeah,
for
no.
us.
Yeah, no, I think it would really be a good place to start. And you know, when you look at so Jeff, we talked about frankincense. You know, if you want to just like give an overview of looking at what you see with the different this combination.
Sure. So, you know, going down the forgiveness protocol, already spoke to the rose and geranium. Frankincense, again, is that thing that connects everybody together, kind of establishes that pathway of I'm talking to you. We then have neroli, which I have found to be very good for the adrenals.
Mm-hmm.
Then, you know, so frankincense, again, pituitary, neroli, adrenals, hormonal system, and talking to itself. That during the process of whatever sort of abuse or neglect or trauma that somebody's experienced, that hormonal system has been sort of the workhorse of abuse. And so that ends up being a pathway that then kicks into gear all too easily whenever somebody encounters any version of stress that's similar to what caused their trauma to begin with. So frankincense and neroli establishes that connection. Now clove is very good for the lungs, which is all about sort of grief and sort of a protective agent. Clove is able to be an analgesic. It eases the pain. So when somebody's experienced trauma, clove can go in there and even from an emotional standpoint, stop sending messages of pain, stop sending the messages of the trauma. Just like it can be a topical analgesic for a toothache, it can be an emotional analgesic as well. Then we've got our Melissa, it was already well talked about, but again, it's sort of that thing for our immune reactions. And again, immunity is the inflammation that can occur even in the brain. The neurological system can be inflamed from emotional traumas. We then have the Juniper Berry, which is about the kidneys. All negative emotions are based in fear. And so when juniper works in the urinary system, it's not only a purgative, it helps to clean up the urinary system, often very good for urinary system imbalances. But in this case, it also is the idea that you can literally have a cathartic pee. You can urinate out your emotions. That's actually a good practice to do raspberry tea, and this would work really well together. Bergamot, very good for the stomach. Often what has happened to somebody in the course of their trauma, PTSD, abuse, neglect, whatever, is that the source of that problem is something that is sort of revulsive to them. That when they think about it, they might get nauseous, sick to their stomach. They might get digestively upset. They might have diarrhea reactions to the point where that trauma brought up really works with the digestive system. Well, bergamot engages those organs to work more properly, work more effectively, to make more enzymes. But even again, from an emotional standpoint, bergamot is uplifting and bright and has that orange, citrusy, sunny kind of feel to it. So those organs perk up and then maybe don't feel quite as much emotion. And then last but not least, the forgive oil. When I test that for people, it frequently comes up that we simply need to put it over the right rib cage. So like we put the geranium over the liver, we could also put the forgive over the liver as well. But the forgive is the basis for all emotional work. When somebody has any emotional problem, any abuse problem, any neglect problem, traumas or whatever kind, there always has to be forgiveness first before we proceed on to any other more specific therapy. So when it was mentioned that we have an alcoholic who may have some anger problems, right away I immediately thought of forgiveness over the liver. If that's all you did, that would help.
Amen.
Yeah.
This is only God working right here tonight, I tell you. You know?
Well, so from that, you saw how easy it was. Does everybody think they could do that in some way, shape, or form to give that experience to someone? So the other part of this is, how do we share an essential oil experience with someone? This gives even an easier way, and Jeff and I are both instructors for the Aroma Touch, and this to me is so much easier. And I know PJ was my mentor for Aroma Touch, and she was excited about this too. It's an easier way to teach people, and it's not as rigid. Whereas the Aroma Touch, only use these oils, do it this way, and you know what, you're going to get a great result if you put oils on the person, period. Right?
Some people like to be touched more, though.
Yes, so absolutely, giving this with some care, which is why I wanted to show it this way. It didn't take a long time, just doing that circle touch. It feels so much nicer with two hands than it does with one. I'll just say that. Circling like this, up the spine, up the neck, and then, just bringing the fingers in. It feels good. So if you want to be able to give someone an experience that feels good, if you've got the time to do that, this is a great way to share that with someone. What I would like to do, and I know, Jeff, we've talked about this, I'd like to go through each of the protocols and explain what they are so people understand it more. I would say, I don't know that I want to wait a whole month. We haven't talked about a time, but we will get this out. So be watching for the information. Does anybody have any questions? Anything else to add?
Julie, did you say that you have some extra books?
Yes, I have extra books.
Okay, I have somebody on my Facebook Live who was just asking how to find the protocols, and maybe I can connect the two of you together and we can get her a book.
And they're in all of the oil supply houses that work with doTERRA. If you Googled Symphony of the Cells, you're going to get Boyd Truman's website,
Yes.
and they're about $12.
Mm-hmm.
And you can also get, I know Carol, you had gotten this, but they have a little, the body systems and essential oils, and then so it lists each system, and then different associated illnesses are on the back. So this is a kind of a cheat sheet also, but I ordered them in bulk because I figured I'd like to start getting groups together and doing this in person as well. But right now this was the easiest way to gather a group together. and
Love it.
Even if we're doing,
I was a big girl.
pardon? What'd you say, Cheryl?
I said, I feel like a big girl now. I'm having fun.
Well, and he's going to be coming to Minneapolis, I think it's October, to do training, and he hasn't done that here before.
No, he's not been here. So, and
It's 6 hours. It's a lot more than you probably need, but he's been doing oils and massage with oils for 20 years, kind of like Julie has. But he went to France and studied with who was it? It was who was it?
Frank Holm.
Yeah.
did you study with him as well, Jeff?
No, I studied with Kurt Schnellbell.
Yeah.
Okay.
But he was in France, so he went to France for a year to study with him, and so that's when he started putting together the not this version. This is he developed it over the years. It works with doTERRA oils, but Boyd's been doing this a long time, and so a lot of times, I mean, it is so cool just to hear from somebody with a lot of experience and a lot of stories. And so, I mean, I'll for sure be trying to go to that training.
Yeah, no, I definitely plan on taking the training, but I didn't want to wait till he came to start getting it out.
Right.
And
You don't need it to do the basics.
no. And I know Dr. Jeff has something that he's incorporating it with, so we're going to be putting a webinar together explaining that as well. And I've experienced Jeff's treatment twice now, and then had the Symphony of the Cells. Afterwards, Shar had given me one the first week, and then I did a protocol for myself the second time. And it's a really nice combination. And I know Kathy, you've been incorporating, or you're starting to incorporate this in your lymphatic practice as well. And you know, you can do this for yourself. If you want to share this with others, just there's lots of ways. This is why I'm so excited. There's so many different ways you can do this.
One of the ways I do, I have been doing the protocols on my husband. I just have him kind of lay on the side of on the couch, you know, with his back to me. I'll do them on him, and then I'll use those same oils on me. You know, it's an easy thing to do. They're already on your hands.
Yep.
You know, you can smell them. You can put them on your neck and your low back and your feet. And, you know, so we kind of do it together. It's really actually kind of nice that way. Someday I'll get him trained and he'll actually do it. But
how are you feeling, Jerry?
I'm feeling it in my shoulder where I had frozen shoulder. I feel something's moving.
Speak up.
I'm feeling in my where I had frozen shoulder.
Uh-huh.
I'm feeling something moving in there.
Okay.
Really strongly.
Okay.
That's a good thing. Yeah, it feels like something is happening, and I know that my neck was tight, and I felt my neck was loosening a little.
Okay. Okay. Well, I noticed I was noticing you doing some movement.
Yeah.
And so she put the oils on herself, and you know, did the protocol herself, and so from that, you know, again, you can still experience a benefit even if you're applying it yourself.
So Amy, when you do your husband, do yourself too.
Yes. Yep.
I did it myself while you were going through it.
Good.
Okay.
And I feel relaxed. I've been cold and tired all day. This is the first time today I felt warm and comfortable. I'm not tired. I feel alert, and it's like, oh boy, what can I take on next?
All right, good for you.
Good. All right. Anyone else have any observation or feedback? Okay. Well, thank you everyone for joining, and stay tuned for the next invitation. Okay. And Cheryl, we look forward to hearing about what you know, how things go. If you want to put a post on the Everyday Oil Enthusiast afterwards for how things went.
Yeah, this client's coming this week. I got to get this going. So.
All right.
Okay.
Once we get this opportunity, it's perfect time for me.
Perfect. Awesome.
Bye.
All right. Well, thank you so much, and we'll be in touch. Okay. Take care, everybody.
Thank you.
Good night.